Well, hey there, welcome to this month's newsletter at Superior Physical Therapy. We're talking about golf as we're getting into the spring, and our first golf course opens today. Bay Meadows, right down the street, opened today. So we're going to talk to you guys about golf injuries. And as I mentioned in the previous video, the top 3 golf injuries that we see on a nationwide basis are: number 1 is back pain. 25% of golfers that are injured experience back pain. Number 2 is knee pain, and number 3 is what's called golfer's elbow, where there's pain on the inside of the elbow. And we're going to talk about 3 strategies on how to eliminate those painful conditions or prevent those painful conditions. So whatever situation that you might be in, or if you had in the past, we're going to talk about the 3 strategies today. So let's first talk about the knee. And what I want to do is give you the most common description of the problem, the most common problem, and then what to do about it. So if you get into a golf swing and you see, what's up, Terry? You get into a golf swing, and let's talk about my left knee first. So when I get here and you see if I'm a right-handed golfer and I go through my backswing, okay, what you'll commonly see in a golfer is when they get towards the end of that backswing, you'll see this left knee kind of drive to the inside. That's normal to some degree, but if it happens too much, you're going to cause a lot of stress on the inside of the knee. And that happens to people because they have groin tightness. There's 4 muscles in the groin called the adductors. And the same thing again, when I go through my backswing, when I come to my follow-through and I end up facing the fairway, this knee also goes through the same motion. And if my groin is tight, it's going to drive my knee to the inside. So by far, with knee pain in golfers, the most common dysfunction that we see is lack of groin mobility. So I'm going to show you real quick how to do something to address that. Since the cage is right here, and I'm going to use it, but you don't have one at home, I understand that. You don't need one either. So what we're going to do here is, all I need you to do at home is find something to put your foot up on, okay? So you're going to elevate your foot, whether that's a chair, maybe it's the side of your golf cart. You elevate the feet and you're going to have them turn to a 90-degree angle. So the right foot's going this way, the left foot's going this way, and then you might want to be next to something you can hold on to so you don't fall over. But basically what you're going to do is simply just drive your hips towards that elevated foot. You're going to try to stay tall, and we're just going to oscillate the hips slightly. So you're going to do about 30 seconds of the motion side to side, and you should feel your groin saying, "Ooh, gosh, I can feel that." Now, after my 30 seconds of that motion, I'm going to now take my hips and I'm going to go around in a rotational motion. So I'm going to choose to do counterclockwise on this side, okay? Counterclockwise for 30 seconds. And again, you should feel that groin stretching nicely. And then, of course, I'm going to switch. I want to do both sides. And again, put the foot up on something elevated. The feet are at a 90-degree angle. And I'm going to go ahead and just go side to side real gently for 30 seconds and then around in circles, again for the groin. This should help with the most common cause of knee pain. Okay, this is part 2 of this month's newsletter at Superior Physical Therapy, talking about golf and the 3 most common injuries that happen to golfers. The last segment we talked about knee pain. This segment we're going to talk about back pain. Back pain is the most common reason why someone has pain during and after golf. And there are many reasons why the golfer can have back pain. The most common reason that I see in the clinic is that when our backs are moving, they're only designed for so much motion. In fact, they're really not designed for a lot of motion. But in particular, we know that the lower back is only designed for 5 degrees of rotation before the bones start to hit the end range. And when they hit the end range, they start to get irritated and inflamed. So you ask yourself, gosh, when I go through a golf swing, that's much more rotation than 5 degrees of rotation, right? So where's that rotation really coming from? And the answer is it comes from the entire body, but the biggest area that rotates the most, or is supposed to rotate the most, is actually the hips. And the hip joint as well as the muscles around the hip. And so you can see here when I go through my backswing, my right hip needs to turn inward pretty significantly, and my left hip needs to turn outward significantly. And we kind of talked about the hip's ability to turn outward in the first strategy where we were looking at the groin. So let's focus on that rotation inward of the back hip. And then, of course, that happens during the follow-through as well, but it happens on the opposite side. So that terminology is called hip internal rotation. How well can the hip turn inward? And really, it's turning inward from a top-down driver. So the club is actually causing rotation up top through my spine into my hips. So how do we improve that hip rotation so that we can take away the demand on the lower back? And that's going to be the movement strategy we talk about right now, is how to improve that hip rotation. All the muscles in the hip are designed to allow the hip to rotate. So there are many reasons why that you can lack that motion. But let's kind of talk about a strategy that maybe gets all of them at the same time. So what I want you to do here is very simple. We're going to take the glove and actually hold on to the club. And we're going to pretend like our right foot's glued to the ground. So it's going to be very, very much stuck to the ground. It's not going to turn or twist. In fact, I want you to put a little bit of pressure on the inside of your heel when you do this. We're going to take the left foot and we're going to rotate around the body like this. So you can see how I'm rotating my left foot around the body, but the right foot staying glued to the ground. And then once I do that, and if I can do that without pain, and really when I get here I feel some stress, some stretching on the outside of my right hip, I'm going to intensify that by taking my club and going with that motion. Okay? So your right foot's glued to the ground, and you're going to rotate across the body, and we're going to try to do that motion 25 times, a couple times a day. So that's for the right hip backswing. Then we're going to focus on the left hip follow through. Plant that left foot on the ground, take your right foot, and you're going to rotate across the body. And again, don't let that left foot move, and you're going to also take the hands with it. Again, we're going to do a high repetition 25 times, a couple times a day. Now is the time to start getting your body prepared for golf so that when the golf season happens, you're not in pain. All right, here's our final video talking about the third most common golf injury, which is golfer's elbow. Pain on the inside of the elbow. It's actually called medial epicondylitis. And these are very small muscles that get inflamed and irritated. And the inflammation causes pain. A lot of times it's called tendinitis. The itis means inflammation. So you have to think to yourself, when does that muscle and those tendons feel stress? And when they feel stress during the golf swing, if it's my right arm, my right inside of my elbow, you're going to see the most stress when we get to the top of that backswing. Okay? And right before we get to that top of the backswing, we're going to come down, and so you're going to feel some stress there. But also, you're going to feel stress when you come through and you hit the ball right about there, and especially if you hit the ground. If you hit that ground, that's really going to cause a lot of stress in the elbow. But we know that one of the main reasons why this muscle starts to get irritated and inflamed is because it's working too hard. So you have to ask yourself, what are the other muscles in the body that also do that same motion? And the answer really is the hips. The hips are going to be responsible for most of the power and motion in the golf swing. But we know that the hips are going to be triggered or turned on by the motion in the upper spine. So really commonly when someone has golfer's elbow, we're going to see that their upper spine, the upper thoracic spine, doesn't move the way that it should. So how should it move? Well, we know that during the golf swing, of course, we're rotating. But we also know that when we rotate, we're also bringing the club up in the air. So we're rotating and extending back. And you can see how my body is leaning to the left a little bit. So it's a combination of rotation to the right and side bending to the left. And it's a motion that really commonly goes away as we get older in the upper spine. And I'm going to show you a strategy on how to improve that motion. So very, very easy. We're going to take our hands, and again, we're focusing first on the backswing. The second part is the follow through. It basically just flips the direction. So you're going to hold the club in your hand. I want you to turn your right palm up, okay? That's to take away stress from the shoulder. And you're going to stand here just like you're going to tee off or you're going to hit the ball in golf. So knees are slightly bent, you're athletic. You're going to take your left hand and push through the club. You're going to push the arm up, and you're going to rotate to the right. So you can see how that really exaggerates the rotation and the side bending to the left. So we're going to drive the motion through my club using my left arm. And again, I want you to try this 25 times. So the right hand goes up and over, The left hand stays pretty level. Okay, and then we're going to switch it. So now my left palm goes up towards the ceiling, and I'm going to take my right arm and push through the club and go up and over. Up and over. 25 times. All three of these strategies are designed to help you move better. So even if you're in pain or not, I would encourage you to do these before you golf. Spend 5 to 10 minutes before you start golfing, and start now. Quick reminder, this month we're offering 10 only free assessments to anybody who golfs and might have pain, okay? The assessment allows us to look at what parts of your body might be contributing to your pain and give you some advice, information. Thanks for listening.